Welcome to the Brilliantly Resilient podcast. What's your train wreck? Everyone has one. The question is, are you going to live there or are you just visiting? Let's check in with Mary Fran and Kristen to learn how to come through not broken, but brilliant.
Hey everyone, before we dive into this week's episode, we have a resource that we wanted to tell you about.
Transform every week of yours with our Brilliance Bit that will deliver right to your email inbox. Sign up for it at brilliantlyresilient.net and keep living brilliantly resilient. Hey everybody, welcome to another episode of the Brilliantly Resilient live show. I'm Kristen Smedley here with my partner in crime, Mary Fran Bontempo. And we have got quite the guest today. I got to say, we didn't actually get to meet our guest when we were at his conference right before the holidays. But you guys, this was a place where when we came off the stage, not only did we have a line of people wanting to talk to us and buy our book, there was chocolate everywhere.
Yes.
It was in Hershey, PA, which is in our guest's backyard. We were a little jealous, and that's why we're all smiling, because we're all still loaded on the chocolate from that conference. No, it was one of our most favorite conferences, so we are so excited that Donald Bucher is here with us today. That was the PA Coalition of Nurse Practitioners, which Donald was the past president, right?
I was president-elect, which I had to resign from when I became president. So I was president for about 15 minutes. So there's a story why, but yes, so I was president for about 15 minutes, but we've been involved with the organization for, my whole NP career. So about 16 years. So
did you have to give that up after 15 minutes because of the State Board of Nursing position that you got?
Yes. So right as 2 weeks before the conference, I was contacted by the governor's office in Pennsylvania asking if I would be a member of the State Board of Nursing, which is a crazy, huge honor. And, I said, sure, as long as I could still be involved in my organization, the organization that I love, Pennsylvania Coalition. And there was a yes, you can. And then there was, oh, wait, there's this law from 1920 that says that you can't be president of a state organization and be on a licensing board in which you represent that, the nursing. So I had to step down.
Good. Well, that's a good story, though.
It's not a bad reason to be kicked out of a presidency. At least there wasn't a coup or anything, where they ran you out of town on a rail. So that's a good thing.
Exactly. Yes. And I really wanted to be there to tell everyone, but unfortunately that I had COVID. So I had to miss the conference, which
it just gets better and better. And for those that are listening and not watching the video, Don's just smiling away. Yeah, then I got COVID, like all this stuff. That's why we were so excited to talk with you today about this element of being brilliantly resilient. And, Mary Fran and I, in our very in-depth production meeting for like 7 minutes, we usually do the whole like, okay, we're going to start here. We look at your story and let's start here. But honestly, Don, this is a little bit different because when we came off the stage, and I was joking about, the chocolate and everything, but the line of folks was so long. We spent so much time out there because people were saying when we did our Brilliantly Resilient presentation, which was we just only had time to dive into a couple of the pillars. They were like, we needed this. We needed this message. So let's just start where if you could give us the state of healthcare workers right now. I mean, what are you seeing? What's happening?
It's really a difficult time to be in healthcare. We are still struggling, with the, fallout from the pandemic, and just now we're going into flu season, and it's starting to be the worst flu season that we've seen in many, many years. So, nurses are just at a point where we love what we do. We're passionate about what we do, but it's just so hard. I became a nurse back in 1998. I, was an ICU nurse my career before I went to be a nurse practitioner. And, I still, I mean, I love bedside nursing. I love being a nurse practitioner, but, over the years, it's just gotten so hard, trying to keep up with everything that's going on in healthcare. You're tasked to do more things, less time, less resources. And then I think when the pandemic happened, nursing felt really left out. We felt behind. Initially, people were cheering when people went to work. Fast forward 4 months and you're being told that you're just in this to make money, and you're just I think the hardest part of it for me, I was working one night and a patient with COVID passed away, and it's 2 a.m. The nurses are overwhelmed. I'm overwhelmed. I call this family to let them know, because it was before there was no visitors, to tell them, that their loved one passed. And immediately I am greeted on the phone with, I'm sure you're just going to say that she died because of COVID. And I'm like, well, sir, that's what happened. And, and he just started on like, you're going to put that on the death certificate because you want to make money. And, I was just so, and I'm a very, as you say, I smile, and I'm always professional, but I ended the conversation with, I just want you to know that the nurse and I held her hand when she passed. Because for me, I needed him to hear that.
Mm-hmm.
I wasn't in it to make money. I was there to make sure his loved one, had some dignity and respect when she passed on. And, the nurse and I, we're in full garb, and I needed him to hear that from me, because by that time I was just like, listen, I'm just here to take care of her. I'm risking the health of my family every time I come in, because I love what I do. So that's where we're at. We're still healing from the pandemic, whether it's a nurse's aide, LPN, an RN, a nurse practitioner, a physician assistant, a physician, all the ancillary staff. We're still trying to kind of regain what we had before the pandemic.
Wow.
The piece of that's so sad is that right at the moment when you're feeling the most human with someone's passing, you were met with something political and the animosity of that. And I don't think most of us, at least me, not until really this very moment, were aware of the punch that you guys took with that. I mean, for people to assume that, their loved ones are dying and you're in the middle of this real horror, this plague, that there was another ulterior motive that was not about you being human and fulfilling your goal. That must have been really, really challenging. Has that abated somewhat, or are you still getting that, that pushback from people?
I will say it's gotten better after kind of last year's surge and things started to taper off. It is better, but still till then, you talk about the things we have to treat it, and people would immediately, you're faced with it. Like every patient you're seeing, someone challenging you and saying, well, no, I don't want that. I want what I heard on TV or on a news story or whatever. And but it is getting better, and I think part of what we're seeing now is just people have left the profession, so it's difficult to recruit. It's difficult to maintain experienced staff, providers. So I think we're all still, and we're waiting for the next thing to come. I think that's the scary part. When all this started, if you asked any of us, we're like, it's not gonna be a big deal. I mean, I remember I was working actually in Philadelphia. I was doing locums, and I was in a small hospital. And I remember seeing the first sign that was like, if you travel to China, and I made a joke about it. I was like, what are they so concerned about? It couldn't happen here. So I think we're still kind of in that state of what's going to happen next. How's the flu going to be? Are we going to be able to, get through it?
I've come to realize that people in your industry tend to be those folks that love to serve, right? And you've got this, take so much pride and joy in being of service. So I can imagine, it's hard. This has been hard for everybody, but for folks like you that are there to serve, to then have and to make people happy and comfortable, and then to have people so unhappy and uncomfortable, it's like a double whammy for folks like you. So maybe if we could for a second, let's talk for a minute, because I really want people to understand the people behind this profession. So you're now representing everyone. So there you go, Dawn. Don't step out of line here. But to give folks an idea, how did you get involved in this field in the first place? Did you always know you wanted to do this? Was it something that happened in your journey?
Yeah. So, when I was in high school, I shadowed a nurse in my local hospital. So I grew up in a small town, in Western PA, in Sharpsville. And the little hospital had where you could go and shadow someone. And I loved biology in school, but I wasn't sure what I wanted to do. So I shadowed an ER nurse, and he was amazing. It was the first time I saw really sick people. And, you're 18 years old. So I was like, you know what, I think this is what I'm meant to do. I really loved the science behind it. And kind of my journey through school was not typical. I went to school, I was like, I'm a major in biology. And then I was like, you know what, that's not really working out for me. Maybe I want to be a physician assistant. And finally, I started working as an orderly in a hospital, and I just fell in love with what the nurses did, and especially in ICU, and how smart they were. And I really was able to see that, they're the ones that are standing there for 12 hours, saving your loved one, picking up on things, calling the provider and saying, hey, this is what's going on. I'm worried about, Mr. So-and-so. So that really started my journey. When I graduated from nursing school, I started in an ICU, and really, I always say this, it's what I was meant to do. I'm not very good at many things, but I really excelled, and really started to think about what I wanted to do as I progressed through the profession. And the one hospital I was working at hired a nurse practitioner, and I saw what she could do. She's managing these patients, doing procedures, and I'm like, you know what, I'm going to do that. So I applied to the only acute care nursing program that was around, which was in Pittsburgh. I was living in Erie, and I commuted back and forth to Pittsburgh for 2.5 years to do it, because I just knew that that's what I wanted to do. And then as I was doing clinical, it just felt right. It felt like this is where I wanted to be, and what I wanted to do, because I had the best of both worlds. I still was a nurse, but I was also able to kind of move to kind of that pinnacle part of my profession where I'm also a provider, and I make decisions. And I remember when I was at the bedside, so I try and keep that piece in my brain every time I'm dealing with a patient and a nurse who says to me, you know what, this doesn't seem right to me. And I think that what makes all nurse practitioners great providers.
I'm listening to you talking about how the nurses are the ones who are standing there and watching for 12 hours. And my daughter is a nurse. She was an ER nurse. Now she's in a PACU, but she will frequently echo many of the things that you're saying. And clearly, not to diminish doctors, I'm not doing that, but it's just like, a mom who is watching their child. You see this, you see what's happening. So one of the things that you said you wanted to talk about was advocacy, and advocacy as a healthcare provider. So here's what I want to ask you. I think typically we see, the doctors are the ones and they make the call and blah, blah, blah. But during COVID, when nobody knew what the heck was going on, was there kind of walls dropping between that hierarchy of doctors and nurses, where there was more collaboration of like, hey, how about we try this? Or what do you think about that? Because really, it was a crapshoot. Nobody knew what the heck they were doing. And is that something that's maybe opened up then and is evolving still now?
Yeah, I think, honestly, I have collaborated and worked with physicians my entire career, and that will never change. I think we work together much better than is perceived when we talk about advocacy issues. When I'm on service, I work with an attending, we talk about patients, I give ideas, they give ideas. And I really feel like it is a great partnership. And with the bedside nurse, we can't do it alone. I mean, not one person directs the care of a patient. The physician may make the final decision on certain things, but it's always with, hey, I saw this, or did you see these labs? And I really feel that it's a great partnership. When we advocate for things, I think there's things we advocate for our profession and our patients that need to break down these walls, because we do need, everyone, that can work to work. We need people at the bedside. We need providers, nurse practitioners, physician assistants, physicians, all to be working together to make this healthcare system work. Because without it, you see these areas where, people don't have access, and health disparities, it's a real thing. And, people think, oh, it's just in rural. No, it's in inner city Philadelphia. It's in, inner city Pittsburgh. It's everywhere where you see health disparities because people don't have access to care. So I do think that COVID did allow a lot of people to see what nurse practitioners can do, see what physician assistants can do, see what respiratory therapists can do. What we can be part of the team, and we can really be, making decisions, and helping patient outcomes and improving access to care. So it's something that I'm very passionate about, because I just know in my little town, which is not far from Pittsburgh or Erie, my parents sometimes they don't have access to an endocrinologist or access to a dermatologist. They have to go to Pittsburgh or Erie, or, so there's room for everyone. And I think if we step back as a profession, all of us, there's room for all of us. It's just about how we communicate with each other. Because I think when people say, oh, he said, she said, they can't do, you can't do, is when walls go up and defenses go up, because, everyone's passionate about the profession they chose. So I do feel that a lot of times that's where, if we have a dialogue that is not confrontational, it's much better for everybody.
You mentioned the word communication, and I'm remembering being in that giant ballroom at the conference, and we have a slide where we talk about the importance of communication, and that landed huge, of course, with that audience. One of the other things, I'm interested to get your take on this. One of the other things we talk about is aligning yourself with people that have the same values. It's quite evident of why so many teams in the healthcare industry are strong and get through things like this, because you're aligned with very similar values. My question for you, though, Dawn, especially in that example that you gave us with the person on the phone, I would imagine that respect, kindness are in the core values of your profession. For those of us that, in the middle of a divorce, when you're trying to have your values and you're dealing with someone that doesn't honor those values, right? Or people dealing with kids with addiction or family members, how do you stand there and decide that you're going to end the conversation in a kind way, staying in your values when you're dealing with these people that want no parts of honoring that?
I think it is really because I truly, when I first graduated from being a nurse, my first preceptor said to me, you have to remember that when we're interacting with a family, they're having the worst day of their life. This is your every day you're going to go to work, Dawn, and you're going to see patients and families. Just remember that they're having one of the worst days of their lives. So you just have to overcome it. And, I've been, having been a nurse for so long. I mean, I had a patient's family that, the guy pushed me up against a wall. Like, he was trying to grieve and he didn't know how to do it. So again, I could have reacted, and I just stepped away. I let him, cool off. He apologized later, but I think always remembering that is key, because it is, whether it's, again, you bring up addiction. I find that patients that seek help for addiction by coming into the hospital, there's still a stigma. And I always try to, people always say, "Oh, Dawn, you're just, you give everyone the benefit of the doubt." And I do, because I just know that maybe this one time is the time that they're going to be successful. And it's someone's daughter, it's someone's son, it's, it could be my child. Like, you have to step out of it. And it's hard, because there's some days where I'm just like, okay, you just gotta, because people will push you to the limit of which you're able to, have that kind of resilience to just be like, you know what, I'm going to step back. I'm not going to react. I'm going to validate what they're saying, but also make sure they're safe, and that we're doing the best thing for them. Because that's what it came down to all through COVID. It was validating that I understand this is what you've seen, what you want. This is the science. This is what we need to do. You could disagree with it, but just know that it's the best thing for your loved one. Though that was the message that I think all of us in healthcare, that's what we said every day. It's, we understand, but this is what needs to happen to keep your loved one safe.
That's an enormous testament to the resilience of your community to be able to do that. And, one of the things that you also talked about is being true to yourself and being true to your value system. And the reason maybe that you went into that profession in the first place, to be of service and to be kind and to be caring. But I never quite thought about it in those terms, that you are called upon to be the best version of yourself while dealing with people who are sometimes at the worst versions of themselves. So this piece of values and this idea of being true to yourself, is this something that is talked about in your profession, or is it kind of a given? Or, I mean, it seems to me that it's something that you almost have to make people consciously aware of. It's probably intuitive for most of you, but as you said, there are probably those days where you're like, get out of my face, and you do have to make a conscious decision to be aware of that.
Yeah. And, I most places, where I practice at now, I mean, they are, we do yearly, training because, microaggression, like, things that, you may not pick up on, but you're doing, being conscious about it. The organization Matt is very big on, share your pronouns, make sure people feel comfortable, make sure that patient who identifies differently doesn't feel different. And we have a long way to go in healthcare, because a lot of places don't do that. So there's trust issues and stuff, but I think that a lot of us, it is intuitive, but you have to, like anything, any skill, you have to, continue to practice and understand what, someone else may be feeling that you've never felt because you've never been in that situation before. On my lanyard, I have 2 pins that I wear. One is a pride and transgender pin, because I want people to understand that they're in a safe place when I'm their provider. The other one's an equality pin, because I work in a heavily female dominated field that is still struggling for equality. If you look at the numbers, a male nurse versus a female nurse versus someone that comes in as a a nurse from another country, the pay is different. So we still have a long way to go in healthcare, but those are things that I want my patients to see too that are important to me. Now, do some of them say, why do you have that pin on? Absolutely. But I just always tell them it's because I want to make sure everyone that I take care of knows that they're in a safe place.
You know, I'm hearing so much of what you're saying is another pillar part of the Brilliantly Resilient process, and that's controlling the controllables. So I'm still going back to this whole, I'm just envisioning you with this person yelling, and other people as they're listening are putting their own life situations, and they, you know, are trying to stick to their values and being of service and all that. And it really is, it's the perspective of you can't control what that other person is going to do. You can't control you can only control what you can control. Stay in your values, still being of service, honoring the equality and all of the other things that you're talking about. That really is one of the big differentiators, I'm sure you're realizing, in whether you are going to up and walk out of this profession or stay in it for the long haul. But I also have to ask you on that, were there situations over the past, how many years have we been in this? It feels like 57, but I guess it's like, not that long. Were there moments of people being grateful and happy for you coming into their situation?
Absolutely. There are patients that, they say, what, I would not have lived without the team that took care of me. And those are the things that carried us through, that I think still carry us through, because disproportionate, like especially after the vaccine came out, there was a disproportionate amount of patients that may not have gotten as sick because they got the vaccine or not in the hospital anymore. So was a disproportionate amount of people that didn't believe in it, the vaccine, that were sick, that didn't maybe have that same message. But I did have people that after they were so sick said to me, you know what, I made fun of this and it almost took me out, and I'm going to get my vaccine and I'm going to take it serious. Just like the flu, like right now, whenever I have the chance on social media, like, get your flu shot, please get it, because we're seeing, really sick people with flu right now. And, I know we have vaccine fatigue, but just get it done. It's 5 minutes at CVS or Walmart or wherever you go, just get it done.
It's funny that really segues into one of the other things that we wanted to talk about, and nurses having answers to problems and being an answer to a problem. I mean, you guys are on the front lines. You see this, and I really wonder at people who think there's another motivation. Like, nobody, you guys don't want people to come in and be sick. Like, that's not the goal. Like, oh yeah, well, we won't have a job if they're not sick, so we want them all to be as sick as possible. That's not how any of that works, because nurses are never going to go out of fashion. There will always, as you said, you're waiting for the next thing. There will always be a next thing. But what do we need to do kind of as a society, maybe, to elevate the voice that nurses have so that we can listen to them? And these are people who see these things every day. You guys have answers. What do we need to do to hear that?
Yeah, it's difficult because, there's multiple nursing professional organizations that, a lot of us felt let us down during COVID. Like, the voice needed to be louder. It needed to be, I challenge every nurse practitioner to join, their local organization, their state organization, their, national organization, because that's how we have a voice. I think people there's a perception of what nurses do, and then there's what nurses really do. When I see things, I watch TikTok because I like it, but like sometimes I see like, oh, well, this nurse was rude and didn't get me water, but I get it, but you don't understand what the nurse was doing at that time. The science behind it, what we have to know and understand, and the medications, and how we're treated from colleagues and peers, and our physician colleagues, it all, I think, really kind of, people don't understand what it takes to work and live in that kind of profession. And I would love for every, congressman and woman to shadow a nurse for a day. Go to your ICU, go to the floor, go to a nursing home and see, the LPN, the RN, and the nurses aide that are taking care of a wing of patients and the expectations that people have on them. And then, when something doesn't go right, the criticism that they get because, oh, what do you mean you didn't see this, this wound on a patient? No one asks him or her, how many patients did you have that day? Oh, you had so many, that's why things didn't go the way they did. So I really feel that nursing needs to really start talking about itself. As you could guess, we don't like to do that too much. We go to work, we do our job. We're not out there saying, this is what we do. This is what, this is the staffing that we need. This is, the representation we need to have when you're looking at bills and you're looking at new legislation. I really feel that every nurse should belong. And I think that every healthcare consumer should really understand what nurses do. And how to do that is, I think nurses need to talk about it, and you need to see them on TV, and you need to, when a star has a surgery and they bring their nurse on their show, that's one of the ways that people can then see, like, what, these are the people that help me get better. So I just think visibility is key, and really getting people to understand what we do.
When I don't know if you know my story, but my first two children, my two boys, were born blind. And when my oldest was born, they initially did not detect any kind of eye issue. So he was admitted into the hospital at 4 months old for 48 hours, doing every test imaginable. And it went from clearing him of a brain tumor to assembling a cancer team, right? So, and I was 28 years old. This is my first teeny tiny little baby. The nurses in that hospital, the stuff that they did to make me not lose my mind, and the care that they gave us and I was a complete and utter disaster, and I was angry. I was everything. Talk about my worst day. And they were absolutely phenomenal. And I'll also share that during COVID, so I gained an incredibly healthy respect for nurses, the same respect that I was raised to respect men and women in the service, because my father was in the service and wasn't respected. It's that when you have that experience, you realize what level. But when I have an interesting story for you. When during COVID, my dad actually had 2 strokes and heart surgery. Right. And he never got COVID. Now, this is probably not a good thing to say, but he says if you have 2 Miller Lights a day, you don't get COVID. We don't suggest that that's how you should operate, but that was my dad's theory, right? That got us through. But the first time, it was during all the lockdowns and nobody could get in. One of my girlfriends from my high school soccer team stayed up half the night combing Facebook for who we knew that was a nurse in that hospital that we went to high school with. This is how my tribe operates. And when I tell you, Don, I got messages all day for the entire time he was in there from these nurses going in. They were on all different parts of the hospital, going in to not only check on him, spend some time with him, and then call my mom and I and my brothers to say, here's what this is happening. Here's what this is happening. And it was like, and they didn't act like it was anything major to ask for. They were happy to do it.
That's awesome. Yeah, again, it's little things. I mean, again, I'm sure the nurses that were doing it was like, oh yeah, sure. Oh my gosh, yeah, we remember her. Let's do it. It's little things. It's, I was, one of the things when I was a bedside nurse, and I still guys that a lot of military guys are big about shaving, and they shave every day. I remember, during COVID, I had a patient and he's like, all I want is shave. I helped him shave because for him, that's what he needed. he
Yeah.
needed that to feel like himself, like, I'm going to get over this. I'm going to get better. So I just think it's taking the time to do those little things, which, sometimes is really hard to do when you're having a really busy day. But, I do think that's what makes the difference, right? That's what, makes someone that is having the worst day maybe be like, you know what, it's going to be okay. Or if it's not okay, I have this support system around me to help me get through it.
Yeah.
Well, this has been an amazing conversation and really eye-opening. Again, my daughter's a nurse, so I do hear from her some of what you're saying, but it's something that we need to recognize is systemic, and we need to recognize that we need to respect the people, regardless of whether you're having your worst day. And I get that. I get what that feels like, because I had my worst day when we took my son in for an overdose. But the people who are there are there to serve and to help, and then they know stuff. They know stuff, like that's what you need at that point. That's the thing to combat those kinds of intense emotions is often information. So that's really helpful information and the kindness that you offer. So how can we support you? How can we find the nurse practitioners organization that we can kind of, just give you guys a hand?
Absolutely. So, Pennsylvania Coalition of Nurse Practitioners, they have a Facebook page. You can just search that. They have an Instagram. You can go to the website, which is pcnp.org, or reach out, I always share this too, you don't have to be a nurse practitioner to be part of the organization. You can join as someone who's not, or you can, contribute to the organization. That's the best way to find them. And, they do great work. The national organization also does great work, AANP. They do a lot to remove barriers to practice and improve patient care. So absolutely.
Awesome. All right, let's jump into our rapid fire reset real quick. These are three quick questions as we're realizing that people need that jolt to reset after, maybe having a bad day, bad experience, or locked in their house with college kids for way too long.
That'll do it.
Our first one on it is, what is your go-to song that just pumps you up and knocks you right out of a bad mood?
I think it's Whitney Houston, I Want to Dance with Somebody is always.
I love that.
That's a great one. That's a great
That's in my head.
Okay, so the second question is, what can you recall a time, and it doesn't have to be about you, it could be something that you saw, something that you heard, whatever, that you just laughed so hard that you were all but crying?
It's probably not a great story to tell, but I'll tell it. So I was working one New Year's Eve, not recently, it was a while back, and it was on night shift, and one of the nurses ate something from the day that she shouldn't have ate, and like the whole shift she is just like, my stomach, and we had a really sick patient, and like it wasn't funny, but it was funny because like she would be like mid-sentence and then gone, like, and all of us, we supported her. She ended up getting to go home, but it was just hilarious because she was just like not horribly sick, but sick enough that it was funny that she was just like, and then she'd be gone. So
disappear.
And we've all had those moments where you just need the bathroom.
You do, absolutely.
And then our last one is, what is a moment that you can recall? It was just like, you're like, I am a rock star. You just rocked something.
I think, I had worked at a place I had a colleague who wasn't very kind to nurse practitioners. And I struggled with this person, and he always felt that he was the end all be all, which is fine. And one day, the charge nurse called me and said, hey, could you come up here? Because there's an issue with the patient, and this person can't do a procedure. He can't get it. And we want to know if you would help. So I come up, and immediately he's like, why are you here? And I said, they called me. And it was an arterial line in a patient. And he's like, you're never going to get it. I've tried multiple times. And I'm like, just give me one shot. And he's like, fine. And in my brain, I'm like, you could do this, you know, because this is a procedure that you love and you could do. And I went in, first try, first shot in, worked pot, and the nurses were just like so excited because they knew our relationship was not the best, and they were just like, yay, Don got the line. So to this day, it's like one of my shining.
Did you do a mic drop moment? Like,
yeah. All I said was, if you need any other help, please let me know.
And then you went out in the hallway and danced to Whitney Houston.
I did in my brain. I was like, yes, it was great.
That's fantastic. I love moments like that.
Don, thanks so much for being here and joining us. This was a wonderful conversation with about a much needed topic, and we're so happy we finally caught up with you, even though we didn't get to see you in Hershey. We ate your candy there, by the way. We ate your share.
Good. Well, thank you guys for having me. It was fun, and you guys made this very easy, and I really appreciate it. And it's I'm excited to get this out to so people could see it. So thank you so much.
Awesome. Thanks so much, everybody, for tuning in. Make sure that you go to brilliantlyresilient.net, blink 3 times, and the magic window appears where you can drop your email in and get a bit of brilliance, a less than 1 minute read, because we don't do anything hard around here. Less than 1 minute read will be sent to your email inbox every week to keep you living brilliantly resilient. We'll see you next time.
Thanks for tuning in to the Brilliantly Resilient podcast. Join our Facebook group and follow us on YouTube to be inspired with tools to reset, rise, and reveal your brilliance.